commitment. If with a torn rotator cuff, a foot, an ankle, what else?
This summer has just been not my total friend.
Oh.
But if I say something goofy tonight, then don't pay attention to me at all, because I also have some pain medication.
Well, I'm glad.
I see.
Are you in a hospital?
No,
Okay, it looks like you've got a TV screen up in the corner.
I do.
It took, like when they've got your monitors up and everything.
I know it.
It's kind of nice drapes though for our curtains.
Yeah.
Oh no,
Well,
Ron's looking so smart. Are you at the library, Ron?
Yes, I'm just trying to get through a few volumes.
Oh.
Wow.
And Peter looks, boy, Peter's
know.
spot is the one I want.
Always at the beach anytime. It's my favorite background.
Yeah.
Well, as someone was saying, now, again, we just heard today as well that there's probably been an extension of the executive order for the remote meetings.
I wondered about that.
Yeah. And so we'll be getting, but we said one of the things we've learned is, a couple of times I've been, oh, wow, that person's home looks so neat and clean. They're like, it's all fake. It's all fake. And I said, I never thought about making a whole house that was a whole, I think about that. Yeah, like TV set. What was I thinking?
Mm-hmm.
You don't think this is part of my house?
Well,
No,
Ron, we did do some, you've had us come down and I know you showed me beams before, but that looks like now you've really certainly reinforced those beams.
The only one that knows for sure that this is fake is Cheryl. She drops off stuff here for me. So she knows there's no second floor for sure.
Well, I would have Bob McCreason. What would scare me all the time is I'd go to drop off the package and the Ring doorbell. On camera.
Mm-hmm.
Oh yeah, I've got the same thing. I know when
That
Cheryl
works
shows
pretty
up.
well, doesn't it?
It kind of freaks you out, even though you know it's there. I'm sorry, even though you know it's there. That's why I can't imagine.
Yeah, so I'm in New Jersey at the shore on my
packages from when you think about the porch pirates, I think, oh my gosh, there's so many cameras now.
Right. You never know who's watching you.
Yep. You don't want to be bad.
No.
We are all set live. We are rolling.
And I know, just as an FYI, Dr. Halverson is not going to, Dr. Helland is not going to make it tonight. I think that's Angie Goral with the phone.
I'm on, but I can't see any of you.
Really?
Well, that's good for you.
No, it's not. Because, well, at least you can hear me. But no, it's not good. It shouldn't be that way. I've tried 3 times, and finally now I've gotten through, but I have no participants. I can't see any participants, is what I should say.
Oh, so you can't see us tonight, Angie?
I can't see you tonight. I can only hear you.
Okay.
It's going to be a little more challenging, Angie. You may want to try, I don't want to frustrate you, but you may want to try one more time because this does require a little bit of visualization from Peter. I don't think you sent out handouts for this, so.
No.
Okay.
Was the slide deck attached to the invitation for this meeting for you?
I don't think so.
I don't have it.
Okay.
So Angie, yeah.
I'll try again.
If not, I can send her the slide deck, Peter.
Okay.
If you send me the one you're going to use tonight. I mean, it's just so I'm making sure I'm using the same one so that we're synced up.
So Jennifer's already reconsidering her participation on this board if they're listening to us.
Not a chance. Not a chance.
Yes.
Well, even though I look like a walking hazard, it isn't from the Board of Health.
How did it happen, Pat?
The shoulder, it's been bothering me since last summer. And I just sort of went through a set of things before I consented in the end because it wasn't getting better. The ankle, I just rolled off the sidewalk edge, trying to get around some people and not get too close.
Oh,
You know, can you hear me?
Yes,
I still am not having any luck other than
That's
I
okay.
might have to dial back in again. I don't know.
All right, I'm gonna try and, can you get things on your internet? I mean, you're able to open emails?
Oh, yeah.
All right, then I'm gonna go in and send you the presentation so you can follow along, at least verbally, with everybody.
But I'm on my computer and I don't know how to split screen.
If I send you as an attachment, you can open it on your screen, right?
mhm.
I don't know. Let's try it and find out.
Okay.
Send it to Alder Goral.
All right. 727 WC Board of Health, Peter, that's the one that you're using tonight? Okay.
Yes.
Sandra, why don't you send it to everybody?
Yeah. Sounds like a plan.
Sure. I'm gonna
So we have a quorum if we count Pat on her drugs, right?
Well,
yes.
I sure would like to see Pat, I'll tell you. It sounds like you've had an interesting month.
I didn't order all of this.
We never do, it just happens.
No, it just happens. Actually, I should be out another week. And so then I'll just have my arm.
like you have only one wing.
Oh, poor thing. I hope you're right-handed.
Because I
and
can't close the Velcro.
Oh,
it's frustrating, isn't it?
So Peter, I just sent it to everyone. You can go ahead and get started and we'll, I
Okay.
don't know, yeah. And again, this is not really a voting in this traditional sense of things you're going to take action on as a Board of Health. It is an exercise that we've put, Winnebago County Board has gone through this exercise. I've had 2 meetings with the superintendents of schools with their various groups to go through it. And it's really to kind of provide some additional context and input into the prioritization of the health priorities. Prioritization of priorities, I guess, is well, yeah.
Excuse me, did you send it to Alder Goral too?
Yeah, I sent it to, okay, I have to expand what I sent it to because I sent it to the whole Board of Health.
Hasn't gone through yet, Ann.
I just, yeah,
Okay,
it just
thank you.
came in
That's all
for me.
Has it come through?
No.
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 Are you
Okay.
able to see? I'm sharing my screen out. Are you able to see
Yeah,
it?
that came through.
Mhm.
Well, I think yeah, it should be coming through. Has anyone gotten it yet? I mean, I know our system's a little bit.
not yet.
No. That's
Not
it.
yet.
That means we're all slow.
Nope.
Yeah, our phone system did go down today, the VoIP, so it
I see our county got special mention today.
Or
Bad numbers and we should put masks on.
Are they
I tried-
recommending masking everywhere?
In the counties that are going bad, and we're one of them, and Boone County is one of them, and yeah, I guess any indoor activity. If I was reading it right.
Well, and
And CDC updated the guidelines today.
Right.
too.
Yes, today, and the Illinois Department of Public Health went along with it for.
right,
Mhm.
we've been recommending that for a while now because we've seen our case counts going up, and we've said vaccinated individuals need to take additional layering of precautions when they're in potentially in situations with unvaccinated. So that's typically pretty much everything that isn't an event where you only have your vaccinated friends and family with you.
Mhm.
You know, and so I mean, I think that that's, you know, it seems like it's new, it's just a reiteration or reinforcement. And I think that they've just really hit on the Delta variant, that on this particular, while when you have a breakthrough infection, even if you're vaccinated, you can be a person that
Mhm.
is to another. So when you're wearing a mask, you're going back to source control. And that's really what we're talking about. You know, you can spread it to those who are not either unvaccinated or not eligible for vaccination. So we started kind of talking about this about 2 weeks ago. That doesn't mean that it, you know, if you go into Walmart, think about it like this, or Menards, any of your big, you know, I'm going to say big box, I'm going to pick on them. But I mean, think about this. If only less than 50% of our population is vaccinated, then 1 out of 2 people you see shopping should be in a mask.
Yeah, and they're certainly not.
And anecdotally, you have not observed that.
No.
Nowhere.
Yeah. And so, you know, that's just a simple kind of rule of thumb, you know, even no matter what they have, the car wash or, you know, any place you go indoors, you know, you think half of them are not going to be vaccinated, you know, people are not going to be vaccinated. And if not half of them are wearing masks, you know, that probably guidance has not been really strictly adhered to.
Yeah.
Your email came through, but there's no attachment.
Right.
It's interesting.
I still didn't get the email.
Well, it's doesn't have anything right now.
Well, all right. I'm going to try to send just to Angie, and then we'll let Peter get started on the presentation.
Okay.
Okay.
She's the only one that can't see it.
Because you can always share it after the meeting too,
Yeah,
if we
and
would
I'm-
like the
I'm
slides.
wondering if there's a problem with our email system and the attachment, because it's showing as an attachment from on ours.
Yeah, I know sometimes I've had that issue where I think I've sent the attachment and it doesn't, it shows it on mine, but doesn't go through.
Right.
So should I go ahead and get started, Dr. Martell?
Yes, I
Go
think
ahead, because I have seen this presentation, so I should be able to
Oh, that's
follow it.
right. Oh, that's right, Angie.
I really don't have to be here tonight.
we're glad you are.
Yes.
We appreciate your participation. You can help explain the exercise if we
No,
get
I can't,
stuck.
but there were too many of us, and I kept getting my numbers screwed up.
Okay. All right. So thanks everybody for joining this somewhat extra and impromptu meeting. This is really to give you sort of a little, to walk through an exercise in prioritization as we're working through the IPLAN process. So I'm going to give just sort of and Dr. Martell and I may tag team the beginning parts of this throughout. Kind of walk through what about the am I
We lost you for a bit.
You were breaking up there.
No, you got muted for some reason.
And Peter, can you make sure that you're in presentation mode too?
yeah, let me
Yeah, maybe.
see if that helps.
There we go.
Okay, able to hear me now?
Yeah.
Yes.
Yes.
Okay. I'm going to walk through briefly about the IPLAN and the Community Health Collaborative, a little bit about the process, and remind you all about sort of the core assessments that are part of that process. And then really coming through doing those 4 assessments, we're going to talk about the strategic issues that were identified and how they aligned with our IPLAN. And then we're going to go through an exercise in prioritization where we need your input around that. So just for a little bit of context, every 5 years, the health departments are required to do what's called an IPLAN, the Illinois Project for Local Assessment of Needs. We produce a community health assessment. There's a formal planning process. All health jurisdictions are required to do this every 5 years. Similarly, all not-for-profit hospital organizations are required to do what's called a CHINA or a China Community Health Needs Assessment. And really, they're supposed to be similarly assessing the community needs, going through a formal exercise. They have to do this every 3 years. And they are required to do this really as part of justifying their charitable hospital status. And so what we find is we need to come together and to the extent we're able to align those exercises, to align the assessment process, we're trying to do that. And so this is a stage in that process. A key part of pulling this together was to form a community health collaborative. And that's part, we've shared this with you earlier when we've talked about this process. The mission of this community health collaborative is to improve health and well-being of our communities through collaboration, innovation, and promotion of data-driven, evidence-based practices. And this is really pulling together both for Boone and Winnebago counties as a shared vision, because Boone is a core part of this as well, that healthy, thriving, diverse, and safe communities, which physical, mental, and social, spiritual well-being of its members is supported and celebrated. So these are really the mission and visions that this group came together and agreed upon in 2019 when this process really got rolling. And we identified a series of core values for the group. This is who the membership of the steering committee and of the members of the collaborative are. You can see that the health departments, the health systems, R1 Regional Planning, Regional Health Council, University of Illinois College of Medicine, United Way, and Transform Rockford are all the core members of this group. And we have been meeting since 2019, although certainly the meeting schedule and cycle was interrupted by COVID, but this group has been working together for a couple of years on this. Both our health department and the Regional Health Council really sort of form the backbone group who have done most of the planning, taking leadership on doing the assessments and doing the work in between the meetings to try to keep everybody on track and to stay focused. The way we're going through to produce the IPLAN is using a tool called the MAP process, which is mobilizing for action through planning and partnerships. And again, most of you would have seen this circle and elements before. This is the same process that was used. I know a number of you have been on the board for a number of years. So you would have seen this 4 or 5 years ago when it started. You've certainly seen it with Dr. Martell and I as we've been trying to keep you updated on the process. There are 4 within the circle. You can see at the top are organized for success, partners, development, and visioning. And so that's really what we did back in 2019. And we laid the groundwork to conduct the assessments. And there's 4 key assessments: a community health status assessment, which is highly data-driven; the forces of change assessment, which is more like a focus group. And we did do that with you as a board in 2019. We did that with a number of different agencies and organizations and out throughout the community. We called them community conversations. There's a community themes and strengths survey, which the Regional Health Council took the lead on for pushing that out through the schools and doing a general consumer survey. And then the public health system assessment really pulls together agencies and stakeholders to try to evaluate how well do we meet the 10 core functions for a public health system, not just for the agency itself, for us, but as a community and as a community system. Those 4 assessments generate a tremendous amount of information and data. Some of it's quantitative, some of it's qualitative. Those really got rolling in the 3rd quarter of 2019, and they continued into the 2nd quarter of 2020. COVID definitely had an impact on our ability to follow through on some of those. The the Themes and Strengths survey hit the streets just shortly before we went into COVID shutdown. And so there was a lot of work done to try to make sure we could still get surveys back in. Really through the second part of last year, we were compiling those results and trying to look at, working with the steering committee, sort of what were the themes that really came out of those. And we identified 7 strategic groupings, if you will. And then earlier this year, the Rockford Regional Health Council, working with its board of directors, sort of picked out of those 7 what they saw as their 3 priorities, with input from the steering group and some others. Those strategic issues that came out from the 4 assessments were grouped. These are not in any particular order, but trying to take all that information and say sort of what themes or issues come out of that and how might we categorize them. These are the 7 that we came up with, that we identified and grouped together. And I'm going to walk through each of these with a little bit and share some of the data points or observations that were used to sort of support those. This was not in any ranking order. But this is one of the things that our steering committee was asked to go back and sort of rank in terms of impact and alignment with their own organizational goals. And the Rockford Regional Health Council certainly did that with their board and through an exercise. So I'm going to walk through these 7. Again, they are not in a specific order. Disinvested and vulnerable. And if anybody has any questions, please feel free to jump in or ask. Disinvested and vulnerable neighborhoods. And we looked at things like poverty rate, food deserts in terms of access to food, food insecurity rates, potential exposure to lead, eviction rates. So a lot of the socioeconomic things that came out, and the different data sets that we looked at, these were a number of things. And we're comparing our performance in Winnebago County to either to the state of Illinois or to national data, mostly to Illinois when we could, to try to get a sense of those areas where we see ourselves as an outlier or an area for opportunity, I suppose. Maternity and early child care was another area that we grouped a lot of the data into and pulled that together. And again, these, for most of you, most of this unfortunately won't be a surprise. We look at our infant mortality rates, we look at low birth weight, very low birth weight. We look at racial disparities relative to health outcomes in maternal and child care. We look at, again, exposure to lead, teen births. I think I have another slide on this. Similarly, within maternity and early child care, state data that looks at child abuse and neglect rates, child mortality rates, again, looking at those disparities, and then looking at things like the C-section rates versus VBAC rates, things like that in our area. The next area that was identified that a lot of these assessments identified, again, both through qualitative and quantitative data, was overall mental health system capacity. And as you know, just before COVID outbreak came through, we agreed in Winnebago County to look at an assessment to help fund the issues of mental health capacity that was really widely recognized by our board, by you, and by others. Shortage of mental health providers, people having to seek care in the emergency room for mental health reasons. Some of the consumer surveys that we did identified reasons that people had barriers in terms of where they saw their potential barriers to accessing mental health care, in terms of affordability, in terms of insurance coverage, and then on the in terms of provider availability, the lack and the limitations. And the data also reported higher rates due to intentional harm, suicide, in comparison. So again, I don't think most of this is news, but these were sort of the issues that were identified and called out within the systems. Similarly, when we look at violence, crime, and public safety, the crime index that looks at crime rates, homicide rates, drug overdose rates, firearm mortality, all areas that support the need to try to continue to address these issues. Specific morbidities as a category really is looking at things like overall mortality rates, issues relative to certain cancer rates that are higher out here, and particularly things relative to asthma and respiratory disease, which are problems in our communities. Also, I mentioned asthma, but higher diagnosis of rates, higher ER visits, tobacco use is high out here. Another category as a strategic, overarching strategic issue that was identified working with the Regional Health Council and with the steering group was looking at education and employment. We look at high school graduation rates and how that impacted people's perception of their health. We looked at how income levels impacted people's perception of self-reported health. Just overall graduation rates, looking at achievement rates for bachelor's degrees were higher relative to racial disparity, again, through a health equity lens. And then finally, the seventh group really was looking at things relative to health literacy and trust in terms of different communities' perception of their ability to even access medical information, their ability to understand information when it's presented to them, and whether they have a high level of confidence or trust in that. This came through the community survey. It also came up through the focus groups that we did, where people talked about how many different sources there were out there for medical information and health information. They didn't know what to trust. They didn't know what to believe. They didn't know where to find it or who necessarily, when there are so many different sources of information out there. And so the category of health literacy and trust, because it certainly impacts people's ability to care for themselves or educate or make choices and decisions. So that was sort of what came out of this current exercise, were those 7 big areas. Just really briefly, I want to remind you that when we did this exercise in 2016, looking forward to 2020, there were 3 of these areas: maternal and child health, violence, and mental behavioral health, were also identified at that time. So really 3 out of the 7 areas that were identified this time had been identified in the past and are continuing through as really strategic critical areas from our point of view. But over the piece that that rides through those 3 last priorities was the issue relative to trauma, the impact of trauma, and so the commitment to becoming a trauma-informed community really helped shape a lot of the work that was done, not just by the health department, but through the community over these past few years. So now we're getting closer to the exercise part that we really want to get your feedback and your direction and thoughts on. So on the left side, you can see the strategic issues. Those are the 7 strategic issues that were identified through going through those MAP assessments this year. Those 7 are there on the left. Now, 3 of them, maternity and early childhood care, mental health system, and violence, crime, and public safety, directly align with what we had identified as our health priorities. And Those three health priorities will continue now into this next IPLAN as the top priorities. But what we really want to get is to better understand which of those remaining four, the disinvested and vulnerable neighborhoods, the specific morbidities, the issues around education and employment and health literacy and trust, and better understand how you see those as they will impact maternal and child health, violence, and mental behavioral health. Here comes the exercise piece.
So Peter, do you want, for those, Angie, we've done a new and improved part from the county board. So really I'm going to take it from here with Peter, was that, so we saw the three of the health priorities that we had in the last IPLAN came up again. And so really taking a look at how do we incorporate the other four and to pull them up into areas and strategies that we might want to consider in terms of addressing our three health priorities. So if you look down, column A is going to be what we call a strategy going down is going down on the column. So disinvested neighborhoods, specific morbidities, education, employment, then health literacy and trust. And again, we're going to cross it across the front of it. You're going to rank it against the others as it relates to. So for instance, if we're going to say A is a lot more than B. So in this case, we're going to say a disinvested and vulnerable neighborhood is more important than a specific morbidity, that's the B, then we would rank that as 10. And when you go back on this, you'll say if A is a lot less important, so if I go down the column, it would be 1/10. And it's a kind of just a technique to help kind of put it in some numerical perspective. So for instance, now we would rank disinvested and vulnerable neighborhoods against education and employment, and figuring out if A is a lot more or a little more, could be equal in importance, a little less important, or a lot less important. And the only numbers you can use are 10 for a lot more important, 5 for a little more important, equal importance being 1, a little less is the reciprocal 1/5, and a lot less important is 1/10. And so we're going to go through this, and Peter's going to do the recording on the actual slides because he's got the slide deck. So Peter, you'll have to advance because I can't, you're the presenter.
Okay. So we're going to take this exercise and now think about these relative to maternal and child health. And I'll keep tallies.
So we're going to go down the column and across the row. So as we look as an impact on maternal and child health, are disinvested and vulnerable neighborhoods a lot more important, a little more important, equal importance, less important, or a lot less important than specific morbidities? What's the group thinking? What do you think if you were to say, are disinvested and vulnerable neighborhoods a greater impact on maternal and child health than specific morbidities? Or are they equally important? Less important? I'm going to open it back up because I have it in a different view here. So
when we talk about specific morbidities, are we talking about something like a high rate of diabetes?
Correct. It could be diabetes, hypertension.
Okay.
And that was kind of the challenge, because when you get our groups together, as you would guess, on collaborative, they can come up with a laundry list of all kinds of specific morbidities.
Okay.
I think it's a lot less important.
Which is less important, the morbidities or the disinvestment?
Disinvestment, if we're talking about maternity.
Okay, well, let's come back though, Peter. I think we got to be clear. We're going A against B. So as a disinvested neighborhood, less important than a specific morbidity on the impact on maternal and child health.
more important.
Hmm,
Hmm.
I'm not sure. I think I might say less important because we have some chronic health problems that really affect maternal and child health.
I agree.
I don't know. If Pat's on drugs, I'm going with her.
Well,
Right.
that would be one of those specific morbidities, Ron.
Well, I heard Jim though say that he thought disinvested was more.
Yeah.
So, and Angie, you get to vote twice. I get it early and often on the board.
I have a hard time because I find that what we're talking about, the majority comes from disinvested and vulnerable neighborhoods. And I'm talking all over. I'm not just talking specific areas.
Mm-hmm.
But when you have neighborhoods that are, to me, that's the most important part because from that comes all the rest of this follows into that category. And I have a hard problem deciding because of the fact that disinvested and vulnerable neighborhoods, I've seen so much of that and what comes out of it and what it breeds. That's my most important thing at this time, to be honest with you.
I changed mine because what you just said, that makes a lot of sense. I feel that they are probably have those specific morbidities because of how they're living and how they're brought up and in the disinvested and the vulnerable neighborhoods. So it's kind of like the chicken and the egg, I think.
Yeah.
I changed my mind.
And you're absolutely right. And when you have lived in these types of neighborhoods for a long period of time, you'll see that those who don't get away from those types of neighborhoods continue on with all the rest of the problems that involved in not moving out of that neighborhood. And I've seen it, I've lived it where I live. So proud of those who have moved away and find that all these others kind of fell in line because they moved out of the hood.
Yeah.
And tell them that I will need to. 7:25.
So if you were to, we haven't heard from Ron or say, so we've got Jim and Jennifer and Angie kind of going that it's more important, and we'll kind of go if it's a lot
Mhm.
more. Or,
I'm with Pat. I think it's less important.
I'm trying, sorry, Ron, but I might be re-examining my own. I'm thinking about all of the things that we've heard and read about trauma and in vulnerable neighborhoods. That just is endemic. And so we know that does affect physical health and mental health. So specific morbidities, maybe the neighborhood is somewhat more important. I wouldn't go with a lot more.
But you'll find in those particular neighborhoods that also education and unemployment have a big factor. That
It's
health
huge.
literacy and trust is another one because it's between themselves, and they always have negative. Everything's very negative when you come into types of neighborhoods, and so they truly, and they never get out. Many of them never get out of the box.
Mm-hmm.
And that's where many of our problems come. They can move, neighborhoods do move in groups. And so they don't always stay stable. They might stay stable for 20 years and then they move on to another neighborhood. But it's like a swarm that moves into that particular neighborhood. And it's kids of the kids, it's generational.
Mm-hmm.
And this is what I have experienced and what I have seen.
Okay.
so I hear that there's a general thought that maybe we're in the positive, we're not in the reciprocal. So it's a lot more or a little more important, or disinvested, a lot more of the specific morbidities, a little more important.
Hmm.
I would say a lot more. I think it all and it's funny, I'm completely changing what I first said. But this is great.
That's why the discussion is so good around these,
Yeah,
actually, so.
easy.
I love conversation, but it all starts from the early age, from the habits that we see, the habits that we take, do we go see a physician? Do we get regular checkups? Did my parents do that? What have I seen? How was I raised? And what will I continue to do? I think it starts there. So I think that we've got to start. I think it's a lot more important.
And I would
Was-
agree, again, a lot more important for all the reasons that Jennifer was saying,
Mhm.
plus Angie and Pat.
And you know, when you look across the top there, really, both the next three categories, specific morbidity, education and employment, and even health literacy and trust, are really all related to this cohort of people we live with and the community we live in.
Mhm.
And we're gonna have to score each one of those relative to.
Yeah.
Start, I'm going to tell you, once you start, it will show you how the reciprocals fill in, because I know it's overwhelming when you first go through it, but this is
Okay.
exactly the conversation. Mr. McCreath, we haven't heard from you.
Oops.
Your mic is still on.
Sorry. Can you hear me now?
Yes.
Yes.
I had said a lot more important.
So are we going to score it at 10? Is everyone, you want to give me a thumbs up, or, if that's what we're going to go for? No, okay.
Yeah, that's okay.
Sorry, Pat, you can't, we forgot, you can't erase anything.
Not funny. I'm sorry.
Sorry.
You can put your, you can use your little emojis on your, we've seen people vote with their hands. All right, so we'll put a 10 there now. And again, this is not a perfect, remember, you're not get graded on this. It's how we put some strategies against. If we're gonna work on some maternal and child impacts, what are we gonna align some of our programming with? So is it things like blight reduction? That will be, something that we align. So just kind of give you some context. So people put a 10 in there.
I'm gonna have to, it's not letting me edit it while I'm in this full screen mode. So I think, let's see if I can do it now. So this would be a 10.
Right, and then
And over here, the reciprocal would be 1/10.
so your 2 blocks, it's like playing Hollywood Squares, as we say a little bit. So now we're going to take a look and say, are disinvested and vulnerable neighborhoods more important, a little more important, equally important, a little less, or a lot less to education and employment? So if you were going to rank those two against each other, so A against B, remember you.
Yeah.
Equal important.
I think education and employment are very much related to poor neighborhoods.
I'd say equal importance.
Okay.
Which is just reaffirming what you said.
Yeah.
I'll go with that as well.
I will too.
So we're gonna end up with 10 on everything?
No, you said they're equal, so this would get a 1.
We're gonna show you some magic on this. This is always hard, as you know, in prioritizing many important things, right? I mean, this is and you got to trust us on this one, Ron. I know it's hard to add a health literacy and trust piece, but we're gonna go for it. All right.
Yeah, I'm having a trust issue right now.
I know. I'm gonna work it for you. So when you talk, and Peter will be filling in the numbers for us. So if you compare disinvest in vulnerable neighborhoods to health literacy and trust as an impact on maternal and child health. So you're talking about how does that, when you think about the impacts on maternal and child health, our high infant mortality, our high maternal mortality, our low birth weight infants, our high infant rate.
And the question before us is health literacy more important, equally important, or less important
Then, okay, it's
than disinvested neighborhoods, right?
it's no, you're comparing A to B. So,
Right.
yeah.
That's
So-
the comparison, but we'll score it based on our disinvested and vulnerable
Neighborhoods,
neighborhoods more or less or equally important as health literacy and trust as it impacts maternal and child health.
I
give it a little more important.
Me too.
These things are so interconnected. I don't know how you can say one is over another.
I know.
You can't get out of the neighborhood unless you have education and employment. And if you're half dead, you're not going to get the education and employment. So you got specific morbidities. And if you're not trusting anybody to get you better or to get a job, then you got trust issues. This is all a mess. I don't know. So 1, 2, 3, 4, or anything else.
And this is the challenge when working in this space around social determinants of health, Ron. We're not saying it's easy. We're saying it's something that we have to work on as we move through this. So, Angie, so I've heard kind of like 5. Is that what I'm hearing? Is that?
Yeah.
Yep.
I'm kind of with Ron on this. They're all, if you don't have the first, then you don't have the other 3. And they're all equally important. And how do we, and so we have to kind of, in our mind, have to go through it. And with health and health literacy and trust, that would probably, for me, override special morbidities. Because if you don't have health literacy and you don't have, and what people are telling you that about health, and you'll never solve the problem of specific morbidities.
Yes, and for now, right now and I don't think you can see this, Angie, but we're looking at disinvested and vulnerable neighborhoods as compared to health literacy and trust.
I'm looking at it.
Okay.
I'm looking at it.
Good.
And that's why I get very confused with this, because of the fact that I know in order that, I don't know, the neighborhood is the most important thing because all these follow. But through that neighborhood, that if you don't have health and literacy and trust, then you aren't going to do the special I can't even say it, morbidities. And that also goes with education and employment. So I'm always confused on these numbers because they all interlock.
Well, and it is, and we'll show you how this is going to play out. We'll get you through this one, and then I think you'll feel better about, and again, there's no perfect numbers. It's a way for us to make sure that we're addressing the 7 priorities in some way, shape, or form against the 3 priorities that have persisted really from our last IPLAN. We haven't cured them yet, and we haven't made them go away. So we got a lot more work to do. So am I understanding that that's a 5 for people?
Yeah.
For
me.
All right. So then, Peter, you can total it across for them on the raw. So that's 16. Okay. Now we're going to go down to the next row. And again, we're going to pair specific morbidities against education and employment, which when you look at specific morbidities, are they more important than education and employment or less important? Let's get, that done first as an impact on maternal child health.
I think I'd go with more.
I would go with less.
Okay.
I'd go with less too.
A little less for me.
Ron?
I would go, if I have education and employment, then I will know more about literacy and trust. So I guess I would have to go with 1. And then with health and literacy, go to the next, what is it, 1/5?
So are you talking a little less important? Or
Well, if you have the education and employment, health and literacy goes, and so does the trust. You have to know what you're talking about and understand what you're talking about in order to have health, literacy, and trust.
okay.
I'd say less.
Okay, so I've heard less, but the
Right.
question is it
Mhm.
a lot
Less,
or a little?
Less.
Le-
Okay, but a lot or a little?
Little,
little,
Yeah.
I would say a lot. But I will,
I think the
Hey, I'll
consensus is a little, but
I'll change mine to say a lot less.
I think we're
This is
kind of
like-
split.
stalemate.
I know, we're not saying this is easy. Remember, this is why we put you, it's like choosing between two great flavors of ice cream, and you can only have one.
I just feel like education is so much power, and with education comes with it good decision making. And without that education, when we're talking about maternal child health, I don't feel that good decisions can be made. So that's why I'm going with a lot.
Mhm. And you also could make a case saying that it's not only education that you need, but employment helps you to access treatment for specific morbidities.
Yes.
Well, yes,
Exactly. I'm the same. I feel the same way.
So it's a
is
lot
it-
less.
a lot less.
Lot less.
Sounds good. I don't know how you get to any of these other things without education and employment. You're not going to get out of that neighborhood. You're not going to have any health literacy. You're not going to have any trust.
Yeah.
You're not going to be doing the right thing.
Okay. All right, we're going to compare specific morbidities. Are they more important or less important than health literacy and trust as an impact on maternal and child health?
Equal.
Equal.
Yes,
I agree.
I go.
Jennifer?
I'm going less. I'm not going equal, I'm going less important. Again, I think if you don't trust your healthcare provider and you don't understand what you're reading or what you're seeing or what they're telling you, then you're just not going to participate.
So are you meaning you're looking at that health literacy with specific morbidities, Jennifer?
Yes.
Yes.
So
Okay.
I'm thinking that specific morbidities is less important than health literacy and trust.
Okay.
I would agree with that.
I would agree with that.
I do too.
So that would be the 1/5 then.
Got that one.
Yeah, I think the.
Is that right?
Looks right to me.
Looks right to me. Yeah, I think
Looks
we're
good,
good.
Peter.
Now we're going to go
Looks
down and see. If you can see, some of the reciprocals are easier to go, and I can't move my screen. I have to hold on a minute.
So
All right.
now we're on education and employment
Mhm.
as it relates to health literacy and trust.
Which
Is
you've already,
it more?
you've already
I
done.
think it's more important.
Yeah.
I don't think you can have, well, the employment piece, that's not really. To have health literacy, it really helps to be able to read and write. But people won't even use it unless they trust.
I think education and employment's more important.
I do too.
I do
Yeah.
too.
I do too.
A lot more important.
I'd give that a 10.
And I give it 11. Oh, wait, there's math involved.
Oh, no. we can't do that.
Count me out then.
I'm not on the finance committee. What am I doing with numbers?
That's
Surprise.
Yeah, all right, Peter, you can, it's an easy one to tally up.
Mhm.
Okay, now this should be, again, You've got the 1/10 there.
Yeah,
Yeah.
all right.
Are we finished?
Just on this one.
We're done?
Just adding up.
Right. I think that's right.
Mhm.
Do we pass?
Do it fast.
You did wonderful. Wait, but you got two more to do.
2.2,
Mhm.
I'm sorry, there's 0.4.
So what are the relative rankings?
Okay.
I'll do that arithmetic in the background.
Okay.
But so what you see is the raw total. Basically, what we'll do is you can see just off the raw totals that overall education and employment was ranked the highest by you, then disinvested in vulnerable neighborhoods, then health literacy, and then specific morbidities. Essentially, I'll tally these and then divide these by that total to get the relative ranking. But you really can see that right here.
So we've determined the least important is whether you're alive or dead?
Whether things like cancer rates or asthma rates as a critical factor in impacting maternal health, you have not rated that as highly as you've rated these other things compared to each other. And this is forcing you to do a trade-off. I mean,
Right.
it's really uncomfortable. It's not
Yeah, I'll
fun.
say, we just killed them off, but we want them to get education.
Well, morbidity isn't just killing us. It's if we have a disease, if we have a diagnosis, diabetes.
And chances are, if we had more education, we may not have those diseases.
We may not, or there may be a huge.
But think about this. I mean, this really allows us then when we're looking at some of the strategies. So practical application on this. So you rank education as being the highest. So one of the areas that we'll be working with as we look at how do we improve maternal and child health outcomes, we'll be partnering and aligning with, our school systems about, educational attainment, graduation rates, those are those indirect impactors on teen pregnancy, things like that. So that will be where we tie, it is a forced choice. That's an uncomfortable forced choice when we're looking at social determinants. But, again, it kind of gives us some framework to help us move some of those. Who will be our partners? What strategies and interventions will be looking at? And so we're definitely going to be, for instance, and I can't remember what every group said, but it may be that, when we put them all together, it could be disinvested neighborhoods and education were big. And I think, Peter, we saw education was probably, the same one across all groups on this particular one. So we don't want to tell you ahead of time what it was, because again, you'll be biased, but they struggled with the same. So educators and elected officials, and now the Board of Health had to struggle through this one. So we're going to go through the next two. I think you got the drift now. Even Ron, I'm sorry, we've got our mathematician Peter's working on the background for all of us, so we can give the relative ranking, and it allows us to put them together. So we're gonna, for the same thing as an impact on violence, if we were to compare disinvested and vulnerable neighborhoods with specific morbidities as an impact on violence, so we're talking homicide, suicide, youth violence rates. Which do we think is more important, disinvested vulnerable neighborhoods or specific morbidities?
I would go with neighborhoods.
Wow, finally an easy one.
Yeah,
Yes, neighborhoods.
I would go 10 on that.
Especially
10.
as related to domestic violence and.
Yeah. No, I don't think cancer goes in there.
No.
Well, but okay, we'll go through this. So, and then, so he's got the reciprocal is 1/10 on the other side. So disinvested neighborhoods, are they more important, equal importance, or less important than education and employment on influence?
And violence.
I think it's less important.
I would say more important.
More important.
More important.
More important for me, I think.
And a little more important or a lot more important?
I vote for a little more important. I think if folks are employed, they're off the streets, they're wanting to do better in their life, they're educated, tend to want to do a bit better, they stay out of trouble. So I can't say it's a lot more.
Mhm. I'm okay with that too.
Empowers?
You can only have 10 once.
No,
So you get a 10,
you can have as many times as you like. You can make them all 10s, but then, you know, it's kind of like there isn't any differentiation. Well, the reciprocals will come out.
They will.
Yeah.
I still think it's more important.
Okay.
I do too.
I mean, major.
Wait, you're saying, Ron, that you think the neighborhood is more important than education and employment. Is that what you're saying?
Yeah, I think you could have a grammar school education and be in the right place and you're not going to have any violence.
Right. Okay. I just wanted to make sure I was understanding the way that you were seeing it. And yeah.
I'm not even sure I understand the way I'm seeing it. So if you
know,
figure it out, you let me know.
I'm still at a 5.
Yeah, I'm at a 5 too.
Well, majority wins, whatever it is.
Oh, I mean, no, again.
The opposite. I think education and employment is more important.
Okay.
There you
So
go.
much for the easy ones, huh?
Yeah. All right. Next page.
So
do we
Yeah,
go
Are
with
we
plurality?
moving
or do
on
we
to
keep
health
talking?
literacy?
we have consensus on this. I think we're somewhere, you might even, you know, you still have equal as one of them, but you know,
Yeah.
and it's, you may say that they're probably equal on, you know, if that's, I hear that they're more important, less important, if they're kind of coming together, but that's.
Hey, that works. Equal.
Equal would work for me.
Yeah,
as
that
well.
works. Yeah.
Okay.
All right. Angie and Jim, are you comfortable with that?
Yes.
We lost Jim.
No, his microphone, I think he is still on mute.
I can't see everybody, so I don't even know if he's still there.
Yeah, I'm still here.
Oh, okay.
You know, when I put a 1 in there, that ultimately that takes its raw total down.
Quite a bit.
It does, but again, it's relative. So are you worried that it may, in the end though, it may have an impact. So you know what I'm saying? I think people automatically think they know where it's going to score on the others. So when we get to education and disinvested neighborhoods, you know, again, the reciprocal fills in.
Right. And that's where, you know, I would agree with a 1 when we did a 1 on the maternal and violence at one point. It lowered the raw total in a way that made me uncomfortable. But I can go with 1. More equal importance.
Mhm.
Well, and especially, I mean, you know, we're trying to kind of come to somewhere we've got some people are saying less important and more important. Kind of a deviation toward the mean then, Jim, you know. And we can come back if people want to take a look again. How would we compare disinvested, vulnerable neighborhoods to health literacy and trust as an impact on violence? We think it's more important.
I would go more important there.
Yeah, same.
I would too.
I would too.
I would, just for the sake of clarity, I would go 5.
The disinvested neighborhoods is a little more important than health literacy.
I think it's a lot more important.
I think it's a 10.
I agree.
Angie?
And
You know, Sandra, you
And
should have given us cards like the Olympic judges. Get a hold up a 10,
Okay, hold them up.
5.
You can do fingers.
You get a
Right,
yellow.
this is the Zoom version.
You know, I'd have to quit because it's too stressful, right? You know, I don't want to have to do that.
Yeah, just watch out for the typhoon
Yeah, I know. Isn't that this?
or the tsunami or whatever it's gonna be.
You know, and yet you see them do all those tricks in athletics and how strong they are. Incredible.
Yeah.
All right. So are we at 10?
We're at
I'm
10.
at 10.
I'm a 10.
So
All right. So we're going to compare now specific morbidities. Are they more important or less important than education and employment?
Less.
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 Okay. Are they a little less or a lot less?
A lot less.
A lot less.
A lot less.
Not
Okay.
less.
Okay. Are specific morbidities more important or less important than health literacy and trust? When
A
we're
lot less.
A lot less.
Less.
Lot less.
okay.
Mhm.
Great.
This is scary. I think I'm getting the hang of this.
By the third,
I-
one, we're breezing
I
through.
give that a 5.
So you're saying a little more important?
Let's go with equal importance. And the reason for that is that, you know, when you think about all that's involved in, I don't know, I'm confused on it right now.
As an impact on violence, Angie.
Right, the impact on
That's-
violence.
And it's an impact on violence.
But-
And I know number one, the impact on violence is probably with the neighborhoods to start with.
Mhm.
But
Well, I know when, you know, specific morbidity.
education and employment is is right underneath that to me. And the next thing is health literacy and trust.
So it sounds like you're saying health literacy and specific morbidities are less important than health literacy and trust as an impact on violence. Well, think about, I mean, maybe give a concrete. Do you think diabetes or having a heart disease versus I'm not good at reading health information and I don't trust the community or the policing, which would have the greater impact on violence? Sometimes you have to get concrete about some of that. Think
Mhm.
about it.
I think less, a little less.
I'm still at a lot less important, that specific morbidities are to me less important with violence.
Yes.
I have to agree
A
with
lot more.
I agree with a lot more. I mean, I agree with a lot less important. I apologize.
Okay,
A lot less.
A lot
Yeah.
less.
so let's give it a 110.
110.
Yeah.
110. 10-4.
Okay.
Ugh.
Mm.
So now we're going to your health or education and employment. Now this is going to be a hard one for you, I know, against health literacy and trust as an impact on violence. Are education and employment issues more important than health literacy and trust, or less important on the impact on violence?
More
I'd say
important.
more important.
I agree.
I agree.
Yes, I do too.
So it's in the positive
If one
direction.
more
Is it
important.
a little more or a lot more?
I think a lot more.
A lot more.
Yeah, I agree.
A lot.
A lot more. Sorry.
So
Okay,
does the dog.
so we'll
You
put
got
it,
cold, Ron?
all right. And Peter, I can't see my reciprocal. I gotta move my screen back over. I have to put my people on the other place. There we go. All right. No, Peter, you got, take a look at your reciprocals.
That's right.
2010.
isn't it?
21,
Mhm,
I think this,
20.1.
mhm.
I think, isn't it, no, but isn't health literacy is
Oh,
education and employment 1/10 as your
sorry. Yep.
Yeah.
Health literacy to education is
It's-
110.
Yeah. All right.
Sorry.
See how quickly we fill these in for you?
Mhm.
So not easy. Everyone's maybe take a standing break because we're on the final home run, final inning here.
Okay.
So for you to look at this, you really, and you expressed to us that you thought that disinvested neighborhoods and education and employment were equally important as impacts on violence.
Pat, don't take a standing break.
I'm not.
All
It's too
right.
hard to get out of the chair right now.
All right. We're going to go on to impacts on mental and behavioral health.
Okay.
So we're going to come back again. And you see the same four. You're going to be tired of these, I know.
Mhm.
The disinvested, vulnerable neighborhood, more important or less important than specific morbidities on mental and behavioral health?
I would say more.
I would say a
I-
little more.
Yeah.
I agree.
I would agree with that.
A little more, you said?
Yes,
Yes.
a little more.
All right. And
Yep.
specific morbidities, you said?
Morbidities.
Morbidities.
Morbidities, okay. No, I'd have to say it's equal.
Really?
Yeah. hmm
Wow.
So,
You know, you don't have to live in the hood in order to have those two things, mental health, behavioral health. You can live anywhere and you can come from the richest family and have those types of problems.
Yes.
There's no dollar signs or educational signs attached to that.
But
And
Yeah, but it's specific morbidities. Am I
It is a-
listening?
that
But
would
I
be
think, aren't you saying, Angie, things like you can be very rich and famous and still have manic depressive illness.
absolutely,
That's what you mean, isn't it?
exactly.
Okay.
Or you can have big, you know, you can have any of those, no matter who you are or what you are.
Could I have another example of specific morbidities? A couple of examples so I know.
Okay.
We talking about health, physical health issues?
We're talking mainly about things like severe depression, bipolar disorders.
Substance abuse.
okay, that's the mental health.
No. I'm asking about
Morbid.
the specific morbidities. Examples of specific morbidities.
Peter, the group that they pulled out were things like
Most of the things that we had pulled out tended to be things along the lines of prevalence of respiratory disease or heart disease or smoking or lifespan, things like that, mortality.
So-
We're not talking about the specific morbidities in reference to mental and behavioral health.
Correct.
But think about, and I'm going to just think about, does having a chronic disease versus living in a disinvested neighborhood, which would have a greater potential impact on mental behavioral health? Does that help put it?
Yes.
I think my neighborhood would have a higher
Yeah.
degree of influence on me.
I'm still at a 5.
Okay.
I'll agree to that. I'll agree to a 5.
I'm
gonna
good
say
with
a
that.
5.
5.
5.
Okay. Angie, 5?
5 is good.
So now we're going to compare disinvested and vulnerable neighborhoods to education and employment on mental and behavioral health. So do we think disinvested or vulnerable is more important or less important than my level of education and employment?
I think less.
I would go with less as well. A little less.
I'd say even.
I would say
I'd say maybe even is, well, I don't know. I was going for a little less.
I would agree with even.
I can get on that train too, if that's what other people are thinking.
Choo-choo.
I don't think it's, I think it's a little less myself.
Little less.
Yes.
Yeah, I think I'm leaning that direction more than even.
Okay, so like a 1/5, is that what we would be talking about then?
Yeah.
Yeah.
If that's the general consensus, yeah, it would be 1/5.
Yeah, I'm okay with that.
And again, I kind of bring it down as, you know, our educational employment opportunities, which would have a greater influence? Is it my neighborhood, or can I get out every day and go and be productive, right? I mean, those are the kinds of things that we're talking about. So that sometimes you have to put some, when you're having a hard time, we'll try and put some concrete things around it.
Excuse me, chances are without an education and employment, you're not going to get out of the neighborhood.
Good point.
I'm going down with my even.
Oh,
Going down with the ship.
are you on the island with the 1 out of 5?
I'm on the island with Peter.
Okay.
Was I too fast in typing that in?
I don't think so.
I'm still
Okay.
there.
Okay.
Angie?
I would say I would go with even.
Okay. So we got a little more discussion to do. So think about, all right, so the even would be my disinvest and vulnerable neighborhood. And let's talk about what, you know, some of our areas where we have, let's say, blight, no shopping, no access to safe and, you know, areas, high crime rates, food, a lot of abandoned buildings. And then I'm going to compare it against education and employment, low graduation rates, maybe that the access to low employment rates, no economic opportunities in that neighborhood has an impact on my mental health.
I guess I would say equal.
Okay.
I would say equal too.
You go right ahead and put equal down, but I still think a little less.
And I think, Bob, your perspective is very important coming out of the employment sector, right? Being in an
Yeah.
you know, we typically don't look where people, you know, I think when you employ people, you don't typically look at their neighborhood. You look at where they went to school, what their grades were, what skill sets they come out with.
Sure.
That's important. That's why we have to have all the views, right? You can't just, you have to talk it out a little bit.
Well,
Mhm.
I'm unemployed and I say it's even.
Retirement is not unemployment.
Oh, I'm sorry.
That's the reason retired people have a bad habit of drinking more, because they have nothing else to do. And that's like living in a neighborhood that's in distress, where you have nothing to do, no transportation or anything else. In fact, right now, I believe the study is that although those that have been home through this pandemic, that we have a big raise in behavioral health and substance abuse.
Yeah, we do
So,
have an increase in.
If you don't have the tools to work with, and you don't get out every day like you should and be active, this is what happens.
It's easy to say when Pat's on drugs and the rest of us are sober.
I know it, but she has a reason for that.
Well, so do we. It's mental
Okay.
health.
You've got a lot of books there, Ron, to escape with and to give yourself some help, self-therapy there. So
Yes.
Yeah, I use them as coasters.
Okay, so are we back to a 1 on this?
Yes.
I thought so.
Okay,
Okay.
all right. So we're going to compare disinvested and vulnerable neighborhoods to health literacy and trust as an impact on mental behavioral health. Is a neighborhood more important or less important than health literacy and trust on mental?
Important.
What was that? Ron?
More important.
I would say either equal or a little less.
And I'm going to say 5.
I'll say
5 is good.
I
I'll go
would
with
say
5.
equal.
I'll go with 5. Oh, excuse me, I'll go with equal. Sorry.
So we're saying disinvested neighborhoods is as equal to health literacy and trust as an influence on mental behavioral health.
Yes.
Oh, wait a minute. No,
No, I'm not saying that.
no, I think it's less. Wait.
I would go with less as well. That's what I first,
Yeah,
I think the neighborhood's a little less than understanding what's happening to you, trusting psychologists, psychiatrists.
Okay.
Is that kind of the consensus, a little less?
Yeah, that's okay.
Jim, we haven't heard from you.
sure I can go with a little less.
Angie, I haven't seen your square light up. That's why I know you haven't weighed in.
I thought I had set a 5 on that one.
Yeah, you did.
So yeah, so the group is thinking, you're saying that neighborhoods are more important than health literacy and trust on mental health. And they're,
I think that's health literacy and trust is extremely important, but you can't have that without the education and employment. And you can't have that if you, many times, because you do live in a disadvantaged neighborhood, you aren't even aware of those others until someone educates you into them. I think they're very important. We need to, in some of our disadvantaged neighborhoods, we need to do more education on health literacy and trust.
so we've got quite a bit of divergence here, right?
you do.
Yeah. That's why I said I think it's a 5.
Mhm.
I still think it's a 5.
I'll
So-
go with a 5.
Wait, we're jumping.
I know. Well,
Yeah,
We're flipping.
I think you brought up a good point.
Maybe
So
we
does
ought
that
to
make us
split
even?
split the difference and make it equal.
Yeah, I will
yeah.
go with
I
equal.
would, I would be okay with a 1.
okay,
Okay, I'm good with 1.
all right.
That seems like the consensus, because we're sort of,
Bounce.
Yeah,
And again, that's when you get a deviation really in the scientists, we get to the median, deviation toward the mean, right?
Right.
We get a split decision as they. So now we're going to compare, are specific morbidities more or less important than education and employment on mental and behavioral health?
Less.
I would go with less, but only a little less.
I would go with a little less.
A little less.
Mhm.
A
I can
little
live-
less.
I can live with that.
Jennifer?
I agree.
Okay, so 1 out of 5. It was an easier one for all of you. Okay, when we compare specific morbidities to health literacy and trust, are morbidities more important or less important than health literacy and trust on mental and behavioral health?
Say less.
A little less.
A little
little-
less.
A little less.
A little less.
I can go with that.
You're not just getting tired, it's a little less, right?
Mhm.
No, we are not getting tired.
Okay, good. I just wanted to do a check-in. All right. We have to move Peter here. All right, kind of in the home stretch now. Victoria,
Last paired choice.
right. So is education and employment more important or less important than health literacy and trust as an impact on mental and behavioral health?
Say more.
I
More.
would too. I do. I agree.
I agree with that.
Yeah, how much more?
Is it more, a lot more or a little more?
Oh, I go with a lot.
Yeah,
I
I think
think
a lot.
I would too.
Yeah, a lot.
A lot.
Mhm.
Is Angie still there?
That's good.
Okay.
Has everyone weighed in?
No, I'm on an island. I'm equal.
Okay,
You joined Peter?
Yeah. Yeah. It's
I
about
left
time,
the
right?
The
island.
weather's great.
Yeah, I left the island, so it's all yours, Jennifer.
Right.
so I mean, again, we have a little diversion. So, divergence here. So, let's kind of talk it through. So when you think about education and employment, schooling, job opportunities, things like that,
Mhm.
are they more or less important than the trust in the healthcare system to receive treatment or care? I mean, is impacts on mental health?
I think you're less apt to understand health and to trust people without the education.
You're absolutely right.
Mhm.
You're absolutely right. Okay, I'll go up to a 5.
A 5.
5 sounds good to me.
Yep,
Okay.
a little more important.
Jennifer
Okay.
just left the island and pushed me back on.
Are you,
I'm
Ron,
still at 10.
you still at a 10?
I am too.
Is there a 7.5?
No. That was, we laughed this, we had, I think the county board wanted all those magic numbers. So no, the numbers are 1, 5.
Yeah.
I want
I
a 5.
try.
Try it.
So talk it through a little bit, Ron. Why do you think it's a 10? You and Bob.
Oh, I just think education and employment answers a lot of these problems and gets us in the right direction for all these people. And that's what's so sad around here with what's going on with education. And
I agree with you wholeheartedly, Ron.
yeah, the employment is so messed up. You have jobs, but you don't have the people trained for the jobs, and they're trained for something else, or they're not trained for anything. And it's kind of hard matching everybody up. And unless you get the education and the employment, so many of these other things don't fall into place.
The only thing that's got me hung up is the trust part of it. Education is black and white. You either can read or you can't. But the trust, it's innate or it's not. I mean, if you weren't born that way or your parents don't trust medical providers and you've kind of watched that and learn it, I don't, that's why I'm not going all the way up to 10, but I will just to belong.
But that's where I
We
agree with
appreciate
you.
it.
That trust with education.
I do agree.
You also need to kind of look at the fact that we only have about 20 different, maybe even more nationalities in Rockford, Illinois. And not only that, but the whole state and the country. And because of that, until they can build trust in our system, and they build trust in our schools, and they build trust in our health field, you're going to find that trust is something that grows on them. It doesn't happen overnight. And through education and employment, they will learn the health literacy and to have more trust.
Mhm.
So they can come from any neighborhood and still have this particular type of problem. It's amazing. Look at all the people who won't get the shot right now, the vaccination, because they don't trust it. So it just, and we were giving them all the information as far as literacy is concerned, and yet they don't want to trust it.
That's a good point. Just telling people facts doesn't always lead to trust, does it?
No.
No. But it can set them up. I can walk around it the way I was originally thinking, and that was that if I have an adequate education and am employed, that I believe that I may have more ability to be resilient in terms of mental health.
Yes.
And that's why I was thinking, comparing that to health literacy or my job and a decent education in my background. That's why I thought in relation to mental health, that the education was more important.
You're
You're
right,
getting me
Pat.
there.
A little more important or a lot more important, Pat?
It sounds we're at a lot.
Yeah.
Because you can't have one without the other.
And so the lock is between 5 and 10, right?
I think we're at 10.
Yes.
Oh, 5.
How many 5s and how many 10s do we have?
It
I think there's 2 10s,
odds. This is
Just
not
2 10s? I got a 10.
you and I.
I raise you, Bob. Oh,
I think there's more than just the two of you at 10 right now.
I think so.
There's-
Yeah, I was at 10 also.
and
There's
Jennifer was the
3.
only one, but again, it's important that we hear it and figure out why that is, or
I will go with the 10 because I think everything that they're saying makes complete sense. I'm just maybe not as,
strongly.
I want the 7.5, Dr. Martell.
Yeah.
You get it in the relative. Okay, we do that, and so we'll put you down for it. The group is a 10 here, and then when we come on the diagonal, and again, you can see how hard it is to rank choice. These very, I'm going to say very broad categories on top of it, but it gives us some guidance about where we put and where we strategize some of our interventions that we have with programs that come into the health department and opportunities. It doesn't, and interestingly enough, I mean, I think probably this group talked the most about trust of all the groups, just as an aside observation, which I think is an important aspect. Whereas,
But I think it's partially because it's so much a piece of the discussion right now around COVID vaccine.
yeah.
And it just sits right in front of us every day.
Sure.
So education and employment, as you can see, was your number one. You want us to work on things like, and again, I think education hours run across almost all 3 of them.
Yeah.
Followed by the disinvested and vulnerable neighborhoods. So those will be things that, and Peter and I will send out the formal scoring with all the numbers so you can see the relative ranking, but we use this tool as a way to help people kind of have that conversation and prioritize. So Peter, you're in charge of the screens now, so.
Okay. So really, thank you so much. I know this was not an easy exercise to do, and the difference between a lot and a little bit sometimes is hard to sort of navigate. But thank you all really for taking that seriously and for the discussion. It's very helpful. Basically, we will tally this up. We'll share the results with you, and then coming out of this, really seeing how these other components support the 3 core priorities. We will draft up action plans. We'll share the results of that. And then as part of the IPLAN process, then it becomes what actions will we take? How do we implement them? How do we evaluate? It's really sort of this bottom part, that we move from those assessments to the issues. We move into goals and strategies and evaluation. And that's a continual feedback. And so part of, if you go back to what we said in terms of the vision, that this is a data-driven process. We'll look to identify metrics. We'll look to identify common ways of talking about this, and that'll help all of our partner organizations also be able to talk about these issues as we go forward.
And so Peter, maybe you can give a little bit of update on timeline, because I know we're working against, they should be prepared in August for.
We'll be coming back to you hopefully at the August board meeting with really sort of these pieces pulled together into a pretty solid framework that you're able to see what the IPLAN would look like going forward for the next 5 years. And then, in September, we submit to the state of Illinois what the formal write-up is of all of this. So you'll see these pieces coming together pretty quickly.
And Peter, we're also working with the health systems that have to submit plans, correct? Are
Yes.
they on the same timetable this year?
They're sort of all on their own cycles right now because their
Okay.
3-year cycle doesn't
Yes.
align perfectly with this. And certainly COVID impacted some of those timelines as far as submissions and things like that.
Okay.
But the goal, not just for us and the health systems, but also working with Boone County, the goal was to try to get us all onto sort of the same cycle, and that we were willing to try to do this on a 3-year, shorter than 5-year cycle to try to keep all these pieces in alignment. I mean,
Yeah.
certainly the pandemic impacted the ability in the short term to keep those all aligned, but
And remember,
that's the goal to work towards, and to have common metrics, common measurements, and to be more clear and concrete that those health systems are really working on the priorities that may not just align with some of their service lines of what they want to do, but with what the true community needs are.
Right,
right,
right.
that's that community benefit impact that really was in the intent of that not-for-profit and the whole idea
Sure.
to do that. So we're starting to have those conversations around, we're simply not going to have, what you saw was morbidities came up, as you would guess, as a discussion. That's why you have a stroke center and a diabetes center.
Yeah.
There's no, those are all important to have, but they're going to have to start putting some resource into discussing about how do they improve maternal and child health outcomes? How do they work on the...
Now, Peter, you forgot one thing that impacts mental health in a major way, probably a 10, is doing IPLAN exercises.
I have a question about this IPLAN exercise. 2 questions, actually. The other groups that you did this exercise with, I think you said educators and county board, and are those going to be factored into this report, or was that just for, okay. And will we get to see how the different groups scored in comparison to how we scored?
Yes, you'll get it as part of an appendices. That's what gets submitted. We're required to put all the assessments in, the results of those. But what you'll see is a compilation in the final product, the summary and the executive summaries. But then you'll see what the groups, the different focus groups. I want to tell you that nobody predicted COVID in the forces of change assessment.
Yeah.
So I want to make sure that everyone knows that was, but some groups, I think we were a little more likely to look at infectious disease. It was interesting to understand environmental impacts. Water, I remember discussing water at one of the groups came up. So kind of some of those things that, when we think about the Chemtool fire and the things that, it's very interesting, Jennifer, to see what people have put together and what they've kind of visioned through and what they've identified as priorities for the community. The mental
I
health.
think that'll be fascinating to see the differences.
It's an arduous process, but the product typically, it's been pretty consistent, and this is part of our accreditation process as well. We're required to use a tool, either the MAP or what they call Apex Public Health, and MAP is pretty much understood by many groups to be used. And so we tried to pull all the groups that do health assessments together so that we don't end up with different results for different groups. Now, we may be prioritizing differently for each group about what we're working on, but we're working on that same, I'm going to say, catalog or list, whatever we want to call it, of priorities.
Thank you.
Yeah, Jennifer, you're going to find out everybody else got it wrong and we got it right.
I already knew that.
Ron, you're ever confident. I love that.
Yes.
But just so you know, Lucy Hoover indicated that they were still without power. That storm went through Wisconsin, which is why she couldn't join us.
Wow.
And Dr. Williams got an emergency. So they just wanted to thank you for all the work you did to prioritize for them.
I'm going to have to leave.
All right, everybody. Thank you again.
Thank you.
Thank you
Good
so
night.